Hello everyone. Today our lecture is about the medication absorption. So I will explain to you clearly about how does medication absorb into the human body. Now absorption means the movement of a medication from the administration site to the bloodstream where it takes effect. So remember that medication can only take action when it is absorbed into the bloodstream and then carried by the blood to the other parts of the body. Now, there are different factors could affect the medication absorption. The first one is the route of administration. So how do we give the medication? Now, this is very important that um, remember that medication must be absorbed into the blood to take action. So when we take the oral medication, we know that oral medication include the tablets and capsules. They must first go through your mouth and then into your esophagus, then into your stomach, and then from the stomach further go into your small intestine. So oral medication must go through the whole gastric system before it is absorbed into the blood. So after the tablets be digested in the stomach and small intestine, from the small intestine the tablet will then be absorbed into the bloodstream. So it actually takes a long process. That's why oral medication normally absorbed slowly with a slower absorption. Now, if we give an injection, for example, the intramuscular injection, if the injection is given into your deep muscle, because it directly absorbed into your body tissue, and the muscle contains more blood vessels, so the medication given by injection actually absorbed faster than the oral medications because it doesn't need to go through the gastrointestinal system. Now, the fastest route for giving the medication is the IV. IV means intravascular. Now, intravascular medication means you give this medication directly into the blood vessel, directly into the vein. Now, through a cannula, so doctor will insert a cannula inside your vein and then directly inject the medication into your vein and then flow into your bloodstream. So IV medication actually will be absorbed faster than both intramuscular and oral medications because it directly go to the bloodstream. The second factor is the dissolvability of the medication. So how fast an oral medication dissolves depends on its form or preparation. So normally a liquid medication absorbs more rapidly than a tablet or a capsule. Another knowledge I want to share is the coated tablet. So you can see that some medication they are coated with color on the top. Now, why these medications are coated? So we call them enteric coated medications, um, because this type of medications can be absorbed better in the small intestine than in the stomach. So we don't want them to be broken down in the stomach because it doesn't absorb well in the stomach. So we want them to actually go into the small intestine and be broken down in the small intestine. That's why we coat it, so to prevent this medication to be broken down in the stomach, because we know that inside our stomach there's a lot of acid, so the acid could break down the tablet. That's why we coat it, so we prevent the tablet to be broken down inside your stomach, and then let it to be further processed in the small intestine. And also food can delay the absorption of some types of medications. So for some medications, we need to give them on an empty stomach or after meals because we don't want the food. The food could delay their effect. Some intramuscular or subcutaneous injection. Now, they will need to be suspended in an oily substance or some type of fluid to provide a sustained release of the medication. Now, this we can introduce it in, later on. Also, degree of blood flow to the area. So we know that normally medications absorbs better and faster in the body areas which contain more blood vessel. And that's why intramuscular injection actually absorbs better than the subcutaneous injection. So we have two types of injection. One is injection into the muscle, one is injection into the subcutaneous tissue. Now, what is subcutaneous tissue? Now, think about our skin. Our skin has two top layers. So first layer is epidermis, and then dermis, and then under dermis there is subcutaneous tissue. It is made of fat. Now, this subcutaneous tissue contains less blood vessels. So that's why the subcutaneous injection absorbs slower than the intramuscular injection because muscle actually contains more blood vessel, while subcutaneous fatty tissue contains less blood vessel. The degree of blood flow, okay, this one we talked about. Now, when we give the injection, doesn't matter we give into the muscle or subcutaneous fatty tissue, to make it absorbs faster, we can use heat or massage. So we can apply the heat pack on the area or give some gentle massage. So these options could help the medications to be absorbed faster. Now, another thing is that normally acidic medications are readily absorbed in the stomach, while alkaline medications are better absorbed in the intestine. Because most medications pass rapidly through the stomach, so absorption normally takes place in the intestine. So absorption actually mainly takes place inside your small intestine instead of the stomach. Another one is body surface area. So body surface area largely affect the medication absorption. Now, normally the larger the body surface area is, the faster the medication will be absorbed. So the more body size, more body surface area. Now, the higher rate the medication will be absorbed. And also the small intestine has a larger surface area than the stomach. Therefore, medications will be absorbed faster in the larger intestine than the stomach. So we know that the larger the size is, the faster the medication will be absorbed. The last thing is the gastric mobility, the gastric movement. So the faster the gastric system moves, the faster the absorption rate will be. Some medications can affect the motility of your gastric system by increasing or decreasing the speed of the motility and affect the absorption time of the medications. So I hope this little lecture could help you to gain more understanding about how medication absorbs in the body and what factors affect the absorption.